This is your Houston chiropractor, Dr. Gregory Johnson, and we have Doug with us today, who came all the way to Houston from Georgia to get work done on his hiatal hernia. And we've been seeing him twice a day, mornings and in the evening. It's about 7:10 p.m. on Tuesday evening, and we're going to give him his second treatment of the day. And I'm going to show you how we pull down the hiatal hernia and stabilize the structure in the mid-thoracic, lower thoracic spine rib cage. So let's take a look at your posture first, Doug. Okay, let's have you flex your head forward and then backwards, please. And as you can tell, Doug's tall, so he's got a long spine. He translated just a little bit to the right. His head's up a lot further than it was this morning. Left shoulder's a little bit higher. His thoracic spine is translated to the right just a little bit right now, as well as his pelvis. Rotation's not bad. That's better, actually. Okay, so now that we have his three-dimensional posture evaluation done, we're going to lay him down on here and decompress him first. And this first time you had this done yesterday, right?
Yeah.
Okay. There we go. Let's slide you down just a little bit. There's only like 3 of us in the whole country that do this. Me and a guy down in Clearwater, Florida, and then another guy in Auburn, California. Dr. Russell Jansen down in Clearwater, and Dr. Dan Murphy up in Auburn. And myself here in Houston. And since we're centrally located, we get people coming from both coasts. So you got good reflexes in his knees, pre-adjustment. So we get this wet towel and put it under his occiput and wrap around his chin. Keep your teeth together. Take a deep breath through your nose. And there you go. There. We give just a straight vertical lift, and it moves everything from his occiput all the way down to his sacrum, because the pelvis is stabilized on both ilii. And then we lay his legs down and relax. And he had brought some x-rays with him on DVD, which if you do come in from out of town, it's great to bring all your diagnostic studies with you. And we saw that he had some substantial degenerative disc in the cervical spine and a loss of the normal cervical curve, and he had problems with that for a long time. But it's actually moving good on the decompression. So now let's roll over here on your tummy for me, Doug. Now, hiatal hernia affects, or acid reflux, affects about 50% of all Americans. So 50% of you guys watching this have probably had heartburn or acid reflux at some point in time in your life. Right now his legs are exactly even, and they stay even, and his pelvis raises up a little bit right there, but not too bad. So he was a little bit to the right, so we're going to move that back left, and we're going to adjust his left SI joint first. It's internally rotated and posteriorly rotated, so that's what I'm adjusting, exactly a mirror image of that. And then the right SI here, internal more than anything. And then in the middle is the sacrum. And I adjust that both right side and left side, and then dead center, superior to inferior on the y-axis. And then L5 straight down the z-axis. L4, L3, L2, L1, and then we're getting right into his thoracolumbar spine now, which this is the area that the lower rib cage attaches to, which is all cartilaginous, by the way. And that also is the supportive structure for the diaphragm, which is what separates the upper cavity from the lower cavity. And that's what really is the underlying cause of hiatal hernia or acid reflux. The ribs get out of alignment, the diaphragm changes position, it gets weaker, it lets the stomach slip up through there and secrete acid into the esophagus, and that's your acid reflux hiatal hernia right there. So this is the natural way to treat this without drugs or surgery, which most people would like to avoid, I think. And I'm doing some muscle spindle work on his paraspinal muscles because they're still fairly tight. Yep. Some sore spots in there. Yep. Yeah. He does a lot of work with his hands over his head, so he's got a lot of tightness up here in his trapezius all the way down into his mid-thoracics here. So we're gonna not use the turbonator on him today. We're going to use this deep vibratory sense to get deeper into the tissues. This will influx blood into the area, bringing oxygen nutrition into the cells, but it also helps the blood carry out metabolic waste products of normal cellular metabolism. It's very useful. Most people like this one a lot better than they do the turbonator, although I like the turbonator because it's deeper, gets more work done. There's supposed to be a forward curved lordosis down in the lumbar spine here, and in the mid-thoracics a kyphosis or a backward C curve, and then when we get back up into the cervical spine it should be a normal forward curve there. It's called a lordosis as well. It's really a 63-degree radially loaded arc forward towards the chin, and down here forward towards the abdomen in the lumbar spine. And it's very important to try to stabilize this thoracolumbar region, which you notice I'm running over that quite a bit more, because this is the stability point for the diaphragm, and we want to keep his diaphragm even and strong so that it keeps the stomach down where it's supposed to be in the lower cavity, so it doesn't secrete acid up into his esophagus and make him have that real full feeling. We have a lot of patients actually coming to Houston from all different parts of the country and even overseas. And George Bush Intercontinental Airport's only about 15 minutes from our office, so most people fly in there and either stay at the Hyatt Regency right across the street or Hyatt Place, which is walking distance. And we got a Marriott here and a Hilton right around here. So it's a lot of hotels to stay at while you're here. If you have relatives like Doug does here, it makes it a lot easier. And we just put a new feature on our website, www.advancedhoustonchiropractor.com, about things to do while you're here in Houston, as well as the links to those hotels and the airport. Okay, so now we've done some soft tissue work there and increased the circulation. A lot of times people get itchy right after that because the blood circulates so much it causes them to itch. And he's good there, that's better. Okay, let's go ahead and turn you on your back now. Now this is the most specific thing that we do for our hiatal hernia patients, and that is we go right below the sternum. There's the xiphoid process, which is a little process right off the end of the sternum. You want to make sure you get below that, and then take a deep breath in. There you go. And then I'm going down deep and grabbing the top of his stomach, which is called the fundus, and bringing that straight down, pulling it down while he is exhaling. Good. And then we do that 3 times. There, that was a good one. I felt that one. And one more. A lot of times you'll really actually feel the release when it pops down through there. You maybe even feel a little gurgle in there when you do it too. That's always good. Perfect. A lot of times you can even feel the abdominal aorta palpating too. Okay, Doug, let's sit you up sideways and face towards Renee there for a second. Yeah.
Much better.
Yeah. His right shoulder, glenohumeral joint. and glenohumeral joint on the left side. And we get his elbow, the radius and ulna here. And then his wrist, carpal bones. Now I adjust all the way through the phalanges, or the fingers. Good. That does not cause arthritis, by the way, if you pull them straight out like that or in the alignment of the joint space. When you get arthritis is when you traumatize those joints by cracking your knuckles the wrong way. There we go, good. Which is like this or this, sideways, either way. But anyway, Doug, has this been worth the trip for you?
Very much so.
Good.
I wondered when I first came, I was getting some relief just from diet.
Mm-hmm.
I'd eaten a real alkaline diet and it helped a lot. But
yep.
Once I got here, I found out that it wasn't really the case. My stomach was still up pretty high. Yep. But at this point, it's down and feeling pretty good.
Yeah, this is your 4th treatment so far in 2 days, right?
Yeah, yeah.
And it started feeling really better today, pretty much for the most part, huh? Where you weren't getting that real fullness feeling in there?
All right.
Yeah, so good. Well, listen, if you're out there around the country and you've got acid reflux or hiatal hernia, if your chiropractor doesn't know how to fix it, we do. So, this is your Houston chiropractor. We'll see you next time.